Welcome to all of my dear friends who have joined all across the geography. Friends, in my this series today we are having my very dear friend Dr. Vijay Dahifade is with us, a very renowned andrologist, sexologist, urologist, and surgeon. He is having the centers all across the Maharashtra and a very popular keynote speaker and motivational speaker. His regular columns are coming, regular shows are coming on the Sam TV also. So, despite of his busy schedule, I am really thankful to him that he has
Yeah,
accepted the invitation. Friends, you can see at this time also he is traveling. Still, he is also eager to share the knowledge and to spread the knowledge to everyone. So, really thankful to you,
yeah,
Dr. Vijay,
yeah,
for
yeah. Thank you, and really a pleasure to be with you. Yeah,
thank you so much. So, friends, as we all are aware that today we are going to discuss about the male sexual dysfunction. So, in these days, we are getting lot of patients coming to us in our OPD for this erectile dysfunction. So, my first question to you, Dr. Vijay, is it like Dr.
yeah.
Vijay? Will you please share the link on your YouTube? So, on
Just a
your
minute.
timeline on the Facebook.
Okay. You have shared it on WhatsApp, correct? Yes.
No,
Just a
my no,
minute.
no. That is your joining link. My
Yeah.
Facebook profile. You go to my Facebook profile. Only search in the Facebook
Okay.
mine and
Okay.
that share it. So it will go live
Okay.
on your also.
So
Meanwhile,
just a
I will
minute.
request to all the participants who are joining, all dear
Yeah.
friends, please.
Yeah. Wait till I join.
Yeah.
Okay.
Okay. Yeah. All those who are joined, please, whatever the queries you are having, you can write in the chat box, post the session. Some questions I'm already having. Post that, we will take your question. So at present, yeah. Some doctors have already joined. Yeah. Yeah. So yeah. So yeah.
Uh,
Actually, Dr. Vijay sir is at this time is traveling, so that's why in between the voice is little interrupting. So, Dr. Vijay, my first question to you, yes, as today we are going to discuss about the male sexual dysfunction. So, is it any particular
correct.
age group for which the male sexual dysfunction is common? Because these days I am seeing in my OPD from youngsters to old age, all are coming for that. So, what is the criteria for that?
Yeah. Yeah. Basically, to all who are joining our this Facebook live, welcome to all of them. And we are really discussing very important points today. Previously, you can say all people used to be willing in old age, with after totally change. If just been 22 year, youngest, and
Oh,
old implant we did
oh,
it in a 75 year.
wow.
So has
22 and
totally
75.
came down. Yeah, this is the range,
Hmm.
and will be surprising. After implant, they gone for marriage. This is the situation. And in our discussion, we'll
Okay.
see why this has happened, what is might be the reason, what are different causes, and now how the lifestyle means the way you are living at present, and why younger generation is affected due to their lifestyle, addictions, habits, and so many, you can say, stressful factors like competition, and they are not coping up with their requirement and how to live the life. So we'll keep on discussing in between our show.
So thank you, Dr. Vijay. So friends, as this is the first question, so Dr. Vijay has already cleared all the point. It is common not only in the old age, but also we are seeing the patients of the young age also these days. So
Yeah.
Dr. Vijay, as you have just pointed out, so related to lifestyle. So my first question, I am targeting to that only because lot of
Okay.
youngsters are coming for that. So
Correct.
so, according to you, what are the causes of this for this sexual dysfunction?
Uh, uh, Ritu, exactly on my TVs and anywhere. Why I started this show like Sukhi Juna Samantra, where I'm including education. So
Yeah.
first and most important, those who are actually not understanding what exactly has happened.
No, sorry, we are not able to hear you, Dr. Vijay. We are not able to hear you.
Okay, it's okay.
Sorry, we are
Now
not
it's
able to
okay.
hear you, Dr. Vijay.
I'll change. Just
Yeah, sure, sure, sure. Meanwhile, friends, as we all know, related to the sexual dysfunction, we are seeing the patients of both for the male and the female sexual dysfunction. And the most common causes at this time we are seeing is the faulty lifestyle, addiction to the drug, smoking, alcohol, and of course the obesity, diabetes, hypertension also causes a major chunk in the part of the sexual dysfunction, not only in the males but also for the females. I am seeing the patients with the, yeah, I will just take Dr. Vijay, I think is joined. Yeah, yeah, welcome back, Dr. Vijay.
it is okay. We can speak now. Yeah. So most important thing, the lifestyle, how it affects nowadays. These
Yeah,
youngsters, these all habits like a smoking and drinking, they take it as
yeah,
a sum of standards of the life.
yeah,
It is affecting all hormones. Even if you last, even at the age of 18 also,
yeah,
I'm telling out both male and female,
huh,
they start smoking.
yeah,
And smoking is so directly that directly affects badly on the androgens like testosterone and estrogen, progesterone in females, and it leads to loss of libido, loss of drive, loss of desire, and with it affects. They at least must should be the limitation. They should be dropped from that. So such a type of habits like smoking, drinking, alcohol, even some additional things also. So that is the poor and poor cause of.
correct, correct. So as you have very rightly pointed out, so is it like that that some drugs also causing this? Because these days we are seeing a lot of youngsters are coming to us. They are taking some kind of medication for a long time.
Yeah.
So I want that you should specify that is it there any kind of addictions and the drugs which are also affecting the sexual life?
Basically, you mean to say the medicines which are
Yeah,
used for
yeah, yeah,
dysfunction, correct? Yeah. Now you are observing very commonly between 30s days of blood pressure, is hypertension, diabetes, depression, thyroid disease, and so many other cases we are observing. So directly the medicines which are given for the blood pressure, especially these different blockers, so they also causes a dysfunction. Then diuretics, especially due to diuretics also there is a causation of a sexual disease. Again, the medicines which are used for depression, again which are used for obsessive compulsive disorders, such a type of medicines, the sexual function, and in that either process of blood pressure also.
okay. So means according to you, this, yes, of course, the antidepressants, which are especially used in
Yeah,
OCD cases, and diuretics are
yeah,
also
yeah,
playing a
yeah.
one
Correct.
major chunk for the sexual dysfunction. So now my
Yeah.
next question to you, as lot of patients once they approach us for the sexual dysfunction, they do lot of googling and then they will approach us. So they ask us the question, ma'am, sir, this sexual dysfunction is due to some hormonal problems. So in the nutshell, I want to ask you that what is hormonal sexual dysfunction?
Yeah. Now, Ritu, in one line, I'll say our body is a hardware and hormone is a software. And
Okay.
body is totally uh, driven by hypothalamo pituitary gonadal axis and our all brain cortexes, prefrontal cortex, this hippocampal cortex, and by any mean, if there is affection of testosterone, and for your information, many people feel testosterone is the only male hormone. It is not like that. In female also, in low doses, testosterone is required for the sexual arousal also. So affection of testosterone, then luteinizing hormone, prolactin, and many other type of dopamine, oxytocin, cortisol, serotonin. Multiple hormones are responsible for sexual dysfunction, orgasm also, but that topic we'll take separately.
Okay, sure. Thank you. So now, as we are discussing about this erectile dysfunction, so is there some classification that how many types of erectile dysfunction has been reported? As just now I asked you
Yeah,
about the hormonal. So, how many
yeah,
types of the erectile dysfunction is reported? Huh.
yeah. Definitely, and and why? And this classification is very important because many people feel that erectile dysfunction is only psychological, and is no way concerned with other condition. It is not like that. Even I'll say it's the equal contribution like psychogenic, neurogenic, vasculogenic, corporal, and condition reflects me the surroundings, conditions, and in which situation that person is living. That all conditions are very important.
Okay. Thank you so much. Means the vascular, neurogenic, psychogenic, or hormonal all plays a very important role.
Yeah, true.
Coming to the vascular, so what are the vascular causes for this erectile dysfunction?
It's a very nice question. And out of all erectile dysfunction, vascular cause is the major.
I think, yeah, yeah, he has joined from another network. Friends, meanwhile, request to you if there are any questions, you can write in the chat box so we can take that. Yes, Dr. Vijay. Hi.
Yeah. So about
Yeah,
vascular causes, I'll tell you the anatomy and physiology in
yeah,
short, so that we can understand how.
yes. Huh. No, sorry, we are not able to hear you, Dr. Vijay. I think your earlier network was much more better. We are not able to hear you.
Then direction. So by any mean, the input which is
No.
going, yeah, input which is going to the penis either is affected by thickening of the blood vessels, either by increased cholesterol, either or either due to type of chronic inflammatory disease, or it can be due to injury and fracture to penis. So this is the reason why it causes a vascular sexual dysfunction.
Thank you so much. Actually, your voice was interrupted for this answer in between. So,
Let it
can you
let it be.
repeat the
And
answer?
which is not
Because,
heard, again,
yeah,
again I'll repeat. So in
yeah.
short, I'll tell you the vascular causes are the prominent causes in sexual dysfunction because after nitric oxide creation, the changes which occur in corpora like cyclic AMP, GMP, PD, and then sacs in the corpora are filled with the blood and outflow is obstructed, then the erection process completed. So anything which is affecting inflow means in blood pressure, there is an inflammation of vessels that again reduces the blood supply to the penis. In diabetes, again there is affection of a vasculature to penis. Again, cases of sclerotic disorder or in few cases of a fracture penis also there occurs sexual dysfunction. So any type of input disorder to the penis and including even venous leakage is also a condition where which causes the sexual function.
Correct, correct. So thank you so much. So now coming to you,
Yeah.
the this is the question has actually come in the by one of friend also. So
Okay.
they written that uh, what are the other health problems which causes the sexual dysfunction?
Yeah, very, very nice and excellent question because sexual dysfunction is one of the, you can say, entity or side effect of other diseases. For example, first and foremost, diabetes mellitus.
Yeah,
Once you get that is the first getting first, his penis prepuce is affected. There occurs shrinkage of the prepuce. There occur cracks on the prepuce. There occurs melanocytis. Patient get pain, bleeding, and see now secondarily he goes for this. Same with the hypertension. If there is a combination of different beta blockers and doses are higher, again there is a suggestion of a dysfunction. So diabetes, hypertension, and depressive disorders, then again which are health related problems related to your lung, problems related to your psychogenic causes like schizophrenia. So I'll tell you, overall, even if you get a simple migraine or headache also, you get a dysfunction because if you are unable to concentrate due to any reason, that
your voice is breaking, Dr. Vijay.
okay, okay. Okay, okay. You
Huh.
want to repeat it me? You want to repeat it? Shall I repeat?
Yeah, yeah, please, because that was totally muted. Not we are not able to
Okay,
hear you.
okay, okay. Now you are getting now. You are getting?
Yes,
Yeah.
yes. Now we are getting. Yes,
So
yes.
Uh, uh, again, most important, erectile dysfunction is one of the sequelae or one of the symptom of all other diseases like a diabetes mellitus. Diabetes is the condition which causes sugar, which goes more than 200, 300. First, it affects the causes phimosis, it causes cracks on the prepuce, it causes melanocytitis, and that causes erectile dysfunction. Second thing, hypertension, uncontrolled hypertension, and the medication which are going for hypertension also affect the sexual function. Again, I'll tell you, any type of obsessive compulsive disorder, depressive disorders, lung disease, or any type of body ache, or any type of pain, any type of migraine that deconcentrate the person and divert the person. So any disease which is caused.
Correct. I think his connection is problem creating a problem. Just take him.
Okay, okay. In between, it may interrupt. No problem. You heard it clearly, or I can repeat. No
Yes,
problem.
yes, yes,
Have
yes,
you,
yes,
have you
yes.
heard it?
I heard. Yes, 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 yes. Heard it,
Mm,
heard it. Huh.
yeah, yeah.
So
Okay, okay. Mm,
thank you for that. As today the net is
yeah.
creating some problems, so I will take last two questions and we will take again once your time and reschedule.
No, no
Now my
problem. No
next
problem.
question.
Mm,
Hmm.
mm.
Thank you
Tell.
so much.
Mm.
Now my next question is that how we diagnose this sexual dysfunction?
So again, I'll tell you, the person who is suffering is the first person who can diagnose it. Correct?
Correct.
Because many people don't accept that he is having dysfunction. This is a big problem. Means, and
Correct.
many people don't know to which we have to
Hmm.
cause as a short define what is sexual disorder. So by any mean, if suppose the person cannot maintain his erection at least more than 1 minute, and till the satisfaction of a partner, or till he will get the proper orgasm, or his partner will get the proper orgasm. Correct? So his history is most important because he is a person dependent. And
Correct.
here during activity, females doesn't come in front to say that, okay, I am not satisfied. Again, they don't say I didn't get orgasm. In fact, female even don't know what is orgasm. 50% females, and that is a big problem to diagnose whether male is satisfying or not satisfying. So first, male has to diagnose and come to the counselor. Sir, I am suffering from this, and then next is our role. We do first counseling. After counseling, we definitely go to the root cause. Then, after eating to root cause, for our hormonal status, we go for hormonal profile, and if required, not in all cases, if required, we go for colored Doppler penis, but that is a very last option. So, history is most important, and hormonal investigation. See, these two factors are most important for diagnosis.
Correct. So thank you so much. So Dr. Vijay, next question to you, as some young doctors have also joining this program. So
Okay,
what
no
are the
problem.
basic hormones you want to do in the patients of this erectile dysfunctions? What
Yeah,
tests are mandatory? Hmm.
yeah. Uh, First, I will tell about the hormonal test and then general. So, in
Yes, yes.
hormonal, most important FSH is the follicle stimulating hormone, LH is a luteinizing hormone, then serum prolactin, serum testosterone. These are the basic hormone tests. And if suppose patient is having associated some diabetes, hypertension, thyroid, or generalized ability, then complete blood count for anemia ruling out, then kidney function test for his renal profile, liver function test for any other affection, or few people are alcoholic. That is the reason we have to go for the thyroid function test, and then general tests which are specific. If suppose there is a some medical line of treatment is not working, then we go for the color Doppler for the vascular checkup. But it's person to person dependent.
Correct, correct. Thank you.
Mm,
Thank you so much.
yeah,
Now coming to the last question.
yeah.
So what are the different modalities are available to treat this sexual dysfunction?
Yeah, correct. So basic only different modalities can be divided at least minimum in 10 talks like this. 10 talks.
Yeah.
Still,
Okay.
I'll enumerate step by step. First line of treatment is we have to change his lifestyle
Yeah.
for sure is possible. Second line of treatment, you have to go for the medication. Again, in medication, there are different medications: centrally acting, locally acting, then short acting, long acting. And again, one picture additional I want to add you: sexual dysfunction doesn't come alone. It is associated with premature ejaculations also, and associated with the penile size problem also. So according to the combinations, we have to keep on changing the treatments. And if suppose to the medical round of treatment patient is not responding, then we have to go for the vacuum therapy. Some people with vacuum therapy also not responding, we have to go for the intracorporeal injections therapy. Again, in few cases in diabetic and sclerotic disorder, low shock wave therapy. It is like a shock wave therapy. And even if for all treatment patient got fed up and there is a no response, then last option is the penile implant. So this is the complete set. So individually, every point is a separate topic.
Correct, correct. So, yes, thank you very much because
Hmm.
you tried to explain as much as possible in such a short duration. And in spite of the bad
Yeah,
network, also,
yeah.
you tried to connect and reconnect so many times.
Hmm.
So,
Yeah, yeah.
today we are not having any questions. So, thank you, Dr. Vijay, for
Yeah.
joining. But I must say, yes, really must appreciate you that in spite of traveling, you have taken out your time and I will take your time again, and we can
Yeah.
reschedule the program again, once again.
Definitely, definitely.
Uh,
So I'll be happy, and it is a very good initiative. I do appreciate you. Such a type of discussions, talks are very, very important to be done on this andrology, sexology, and there are so many factors. And we'll continue this series. And best wishes to you
Thank you,
also.
thank you, thank you so much, Dr. Vijay.
Yeah,
So, friends, with
yeah,
this we will
yeah,
wind up for today.
yeah,
Sorry, because of the some
yeah.
network issues, Dr. Vijay was not constantly able to connect. So, thank you to each and everyone, those who have joined.
You can tell them on every Friday I'm on Sam TV 11:30 live. Every Saturday
Okay,
11:30 I'm live on NDTV, and they can search me on YouTube also, so that next time they are with the very good questions and very good knowledge.
great, great, great,
Yeah,
great,
yeah.
great.
Mm, yeah,
So, so thank you for sharing this. So, with this,
yeah,
we will wind up for today.
yeah.
Friends, bye
Okay,
bye. Good
okay.
night.
Yeah.
Good
Bye,
night.
bye. Good night. Yeah.
Bye. Good night.